So I want to welcome everybody back to the latest installment in our series on faith and the COVID-19 vaccine. I am delighted to be here today with my own teacher, Rabbi Elliot Dorff of the American Jewish University. Rabbi Dorff is a theologian and ethicist specializing especially in the field of medical ethics. He is the author of 11 books and over 200 articles. And so thank you so much, Rabbi Dorff, for being here with us today. Rabbi, the first question that I would like to discuss is, can you talk to us a little bit, helping our readers and listeners understand the whole framework of health in Judaism, and especially public health from a Jewish perspective?
Sure. One of the ways that I sometimes put it is that there's been a virtual love affair between Judaism and medicine for the last 2,000 years. A lot of rabbis were also physicians. Maimonides is probably the most famous of them, but there were many, many others. That doesn't happen so much anymore because it still takes more or less the same amount of time that to go through rabbinical school as it did then, but to go through medical school takes much, much longer. So there fewer rabbi MDs than there were in times past. But there is a real, and this comes from the Exodus chapter 21, when somebody has assaulted somebody else. Among the remedies that the assailant has to provide is v'rapo yirapeh, he must surely heal him, from which we get already the permission for human beings to engage in healing. It's not taking away God's prerogative. Quite the opposite, the way that the Jewish tradition sees medicine as helping God do what God wants, namely to prevent diseases as well as cure them. And that's been true not only in the clinical setting, but also in the public health setting. This goes back again to sources in the Torah itself, where quarantine already is used to prevent communicable diseases in chapters 13 and 14 of the book of Leviticus. So they already had that sense that you had to protect the public from a communicable disease. And then in terms of preventive things, the rabbis already have a sense that you should eat fruits and vegetables, not too much meat. You need to get exercise. You need to sleep. I mean, all of these preventive things to try to prevent people from being diseased in various ways, right? And that goes, I mean, in the 18th century, when Jenner first created the smallpox vaccine, the question was, should you take it, given the fact that it wasn't yet proven? And the answer is yes, you should, because the opposite piece of that, namely, if you get smallpox, that would be terrible. That would be terrible not only for the individuals who would probably die from it, but also because it was a pandemic at that time, and we owe it to each other to try to prevent diseases, not only for ourselves, but for others, especially in that case, a communicable disease like smallpox, in our case, COVID. So, I mean, there's a very strong sense in the Jewish tradition that we ought to get involved in medicine, both to prevent disease and to cure it, both on the clinical level and on the public health level.
Thank you, Rabbi Dorff. And I'm wondering if you could say a little bit more in terms of the Jewish interest in health and in medicine from a faith perspective, right? Why does that figure so strongly in our faith and our relationship to God and community?
Well, because this is very different from the American side of my identity. I'm very proud to be American for all kinds of reasons. But the American side of us is that we hold these truths to be self-evident, that all men are created equal. They're endowed by the Creator with certain unalienable rights. And among these are life, liberty, and the pursuit of happiness. So as an American, I'm an individual with rights. The central Jewish story is Exodus, Sinai, and then trek to the Promised Land. At Sinai, we don't get a single right. We get 613 commandments. Sometimes when I do a lot of interfaith work, and sometimes when I tell Catholics that this is the beginning of Jewish guilt, they tell me, no, you don't know anything about guilt. We have that cornered. In any case, as a Jew, I'm a member of a community with duties. As an American, I'm a member, an individual with rights. Now, rights and duties sometimes are reciprocal. So if you have a right to your property, I have a duty not to steal it. But rights and duties are not always reciprocal. And in any case, if I get up in the morning and I'm an individual with rights, then the world owes me. But if get up in the morning, I'm a member of a community with duties, then I owe the world. So the whole way in which you think about yourself and in your life is completely different in these two ways of looking at life. And another thing that's really very different is that in the American understanding of things, back to at least the Nancy Cruzan decision of the US Supreme Court in 1990, I own my own body. And, and as long as I'm 18 or above, I can refuse any kind of medical intervention. I cannot demand it, but I can refuse it. Whereas in the Jewish tradition, my body belongs to God. And I have a fiduciary relationship to God to take care of my body during my life. It's as if I were renting an apartment. I would have reasonable use of that apartment, but I may not damage it or injure it, and I certainly may not destroy it. And I must take precautions to make sure that the apartment is in reasonable shape. So in the same sort of a way, I have a duty in the Jewish tradition to take care of my health. So I may not abuse drugs or alcohol or smoke, given what we know about that. And those things on a public health level in American law are also prohibited because I might harm somebody else, right? In American law, I can do whatever I want as long as I don't harm somebody else, right? And we know about secondhand smoke and people who are drunk and drive. I mean, we know about those kinds of things. But let me give you one example, my Achilles heel. In American law, there is nothing that I know of anyway, that would prohibit me from eating a half a gallon of ice cream every night of the week. And as long as I'm doing it, it might as well be mint chocolate chip or cherry Garcia. That stuff is so good. Anyway, but from an American pragmatic point of view, it's really a bad idea because I would gain 500 pounds in no time and all kinds of bad things would happen. But there's no law prohibiting me from doing that because I own my own body and I can abuse it in that way. I may abuse it in that way according to Jewish law. But in American law, I don't have that right because my body belongs to God and I have a duty to preserve it and to take care of it. And so the duty to worry about my health is, if anything, not simply a pragmatic duty, but a religious duty in the Jewish tradition, and therefore has all the more power behind it.
Thank you. I just want to point out for our listeners, Rabbi Dorff, just when you said that, the last part you said as an American matter, but you meant as a Jewish matter, right?
Yeah.
That as a Jewish matter, we have the obligation.
That's right. As a Jewish matter, I have the obligation to take care of my body because it belongs to God.
Right. So, thinking right now about vaccination, one of the interesting things, we are recording now on February 2nd, and the cause for starting this series was to really look at issues of vaccine hesitancy and how the faith community could help play a role in ending the pandemic. And one of the things that's happening now is that vaccine hesitancy is getting eclipsed and hidden a little bit because there is a vaccine shortage still, and many, many more people who are eligible and want the vaccine than doses available. And yet at the same time, we are hearing a number of studies that show that in a lot of healthcare institutions, first responders, people who give home care, that there remain people who are, for their own, sense of well-being, hesitant to take the vaccine. And I wonder, what do you think faith leaders can do to help healthcare workers in their community be able to take the vaccine, be more willing to take the vaccine?
Well, the first thing is public education. Sorry, unlike the smallpox vaccine or the flu vaccine, this vaccine does not inject into you even even a weakened form of the virus. This vaccine was made through our DNA, and so it has no trace of the virus whatsoever, and therefore is frankly much safer than most of the vaccines that we're used to, and that have been around for decades, and that have helped us for decades. So even those vaccines, I would say you should take, because we have a proven record that those vaccines prevent very serious and sometimes even lethal diseases. So the usual vaccines that we give to children, the flu vaccine every year we should take, the polio vaccine, all of those kinds of things, we really need to take, even though those are weakened forms of the viruses that they're trying to prevent. This one is not that at all. And so there's no danger to it at all. And there is, I mean, a far higher effectiveness rate in this vaccine, in these vaccines, than is usually accepted as being safe and effective. I mean, if any medical intervention helps 50% of the people, it's going to get FDA approval. This has been shown to be 95% effective, both the Moderna vaccine and the Pfizer vaccine, and now Johnson & Johnson is coming up with another one, right? I don't know the exact amount of effectiveness for that one, but still anything over 50% is well worthwhile, because remember what we're talking about is COVID-19, which has taken over 400,000 lives in the United States, over 2 million lives in the world. This is not fun and games. This is really serious stuff, this disease. And even people who manage to recover from it often have long-term effects of it. I know a few people like that are still having breathing problems, even though it's been more than a year since they were first infected, right? So, I mean, this is, by the way, sorry, this is, sorry, not more than a year, more than 9 months since they were first infected. But you don't want to do that, right? You want to prevent the disease. Not only do you want to, but from a Jewish perspective, you have a duty to prevent disease if you are able to do that. So it seems to me that two things are important here. One is public education about exactly what is this vaccine and what are its risks, which are frankly unknown, but minimal as far as we know. And nobody has gotten bad effects on this. I mean, there have now been many, many people who've been vaccinated and with no reports of really any, any bad effects. And so first of all, public education. And the second is a reminder to people, starting Leviticus 13 and 14, right? We need to take what public health officials are saying seriously. We need to wear masks whenever we're outside of our homes. We need to publicly distance, right? We need to wash our hands frequently. We need to do all those things that these public health officials are saying to us, and we need to get vaccinated when it's our turn.
Thank you, Rabbi Dorff. And so to pick up on that idea of when it's our turn, because people are so afraid of the COVID virus, we are hearing some cases of people, they use the term jumping the line. And some people who are not yet in eligible categories within their states, getting vaccinated or attempting to get vaccinated. And obviously, people have a lot of temptation and fear in that regard. Could you address that from a Jewish faith perspective?
I mean, it goes back to justice shall you pursue in Deuteronomy 16. That is the reason why there is a line to begin with is because there is a shortage. And the Jewish tradition knows about allocation of scarce resources, not medicine until the 20th century, because until the 20th century, medicine was pretty good at preventing diseases, but not at all good at curing them. But the Jewish tradition in two other areas of life had to face the question of how do you allocate scarce resources? Namely, how do you decide among the poor who gets what and who pays who pays for it so that the poor can be sustained? And the other had to do with redeeming captives. And the question then was, well, to what extent, and we're talking about poor Jewish communities who are trying to help the destitute or trying to help somebody taken captive, right? We're not talking about the Jewish communities through the ages were not rich. They were largely poor. Yes, there were a few rich Jews along the way, but the vast majority of them were poor. So we're talking about the poor helping the destitute. And what emerged in the Jewish tradition is an order of who's most vulnerable. Those are the people that have to be helped first, and they have to be helped in the way in which they are most vulnerable. So do you give people food first, or do you give them clothing first? Right? To some extent, it depends upon where you live. I mean, I grew up in Milwaukee, and in February, it's often below zero with 2 feet of snow on the ground, right? And you're probably more likely to die of being frozen to death than missing some food for a while. So maybe clothing under those circumstances is more important than food. On the other hand, if you live in Mediterranean areas, then then food is probably more important than clothing, right? You obviously want to give them both, but if you can't, then you have this kind of pecking order, as it were, to try to serve the most vulnerable first. And that really, I think, is what the Center for Disease Control and Prevention has tried to do in its 1A group, its 1B group, its 2 group, and so on. And I think we owe it to each other to respect that, right? Yes, I understand it is really fearsome. I just said before, this is not fun and games. This is a lethal disease, right? And we need to try to get everybody vaccinated as fast as we can. But we need to understand that the most vulnerable are the ones that really need to have that vaccine first. And we need to be able to wait in line, even though it's scary, and even though it requires patience. We really need to be adults in this.
Thank you. Rabbi Dorff, one of the things you mentioned before, you started to say mental health for a minute.
Yes.
And I'm wondering if we could address some of the mental health ramifications for COVID-19 on our society, which has affected everybody, not only people who become infected, but all of us. And think a little bit about, what does Judaism teach, both as individuals and as a community, about people managing the ramifications of isolation, anxiety, depression? Could you, give us some reflections on those issues?
Sure. The Genesis chapter 2, it's not good for a person to live alone, right? We are indeed social animals, the way that Aristotle put it. We all need some time alone, but we also have a desperate need to be in touch with other people. I mean, if you have any doubt about that, just think about the prison environment, where aside from execution and torture, the harshest penalty is solitary confinement. And unfortunately, we have a lot of evidence of the fact that people who are held in solitary confinement for long periods of time go insane, right? Because we have a very deep need to have connections with each other. And so a large part of the mental health pieces of this pandemic is that people are feeling very depressed, very isolated, and that has led to increased alcoholism, increased family violence. I'm a past president of Jewish Family Service in Los Angeles, and we have seen a real uptick in the need for clinical care, and the need. We run some shelters for women and children who have been battered, and a real uptick in the demand for those. I mean, this virus is physically terrible, but it is also mentally terrible. So there again, we have to take preventive care for ourselves. And what does that mean? That means, well, don't reach out and touch somebody, literally, but do reach out. I must say, I do a lot of teaching and webinars like this, and in some ways, I'm really sick of being in front of my computer screen. But if we did not have Zoom, and if we did not have some FaceTime and some of the other ways in which we can communicate, this disease would have been much, much worse, because we would be all the more isolated. So that I really do understand why people really are fighting this. They really want to be together. You want to be able to, most of our services now are online, right? But you can't sing together online. You certainly can't enjoy some food afterward online and just talking together, right? There's a real limit to the way in which Zoom can connect us. That said, we should use it to its fullest. So talk to people that you haven't, talk to your friends, make appointments to talk to them. That's the hard part now. You, in ways that you used to just see each other while living life. Right now, you actually have to make an appointment to see people, but do that. And I just recently, I just talked to a high school friend of mine I haven't talked to in decades. Right? Take advantage of the fact that you're isolated at home. You can't go to the movie. You can't go to the sports game. You can't, and all of that, right? So that's terrible. But take advantage of it and think about people that you've known in your life and that you haven't talked to in a while. It will brighten your day. It really will, and it will brighten your mood, and it will really serve to keep you mentally healthy, which is in the Jewish tradition. That is part and parcel of what it means to take care of yourself. In this way, it's really very different from the Western tradition, going back to Plato, where there's a real dichotomy between your mind and your body, right? Your body is in Plato, your body is the animal in you, your mind is the distinctly human in you. And what that led to in Western thought is what's called the mind-body problem. In other words, if the mind and the body are so separate from each other, then how are they at all connected? Descartes in the 17th century thought they were connected by a pineal gland. It's a gland in your head, that's the magical place where your mind and body are connected. But in the Jewish tradition, going back at least to the Talmud, if not earlier, there's a recognition of the fact that we are an organic whole, that our mind, our emotions, our will, and our body, they're all connected to each other. And so consequently, taking care of yourself doesn't mean just taking care of yourself physically. It means also mentally and socially. And by the way, economically. We have to be aware of the fact that there are increased numbers of people who are in dire need economically. And so those of us who are able to have a special duty now to try to help them. I mentioned that I'm still on the board of Jewish Family Service. I've also been on the board of the Jewish Federation here, and multiple people are just falling through the cracks. I live in Los Angeles, where there are tens of thousands of people who are homeless, and that is just simply, that number has skyrocketed, and the government, Mayor Garcetti and the city government are now trying to create some at least temporary homes for as many people as we can. We really have to get behind those efforts. We are in this together. If nothing else, Judaism is a communitarian religion. It says to us, love your neighbor as yourself, Leviticus 19. It says to us, you are responsible for everybody. Do not separate yourself from the community, right? Those kinds of community, we see each other as members of a community with duties, going back to the Exodus story. And those duties, if anything, are greater now during the pandemic than they were before it.
Well, Rabbi Dorff, I think that those are really very powerful closing words to understand ourselves as a sacred community and understand our responsibilities to each other within it. And so once again, I thank you so much for taking the time to be with us and to share Judaism's wisdom in this. And I will end the recording.
Okay.